Alrighty, yo, what is up? This is episode 10, I believe. I think it's 10.
Yes,
Or is it
10. And I don't know.
I think it's 10. No, we're good. It's 10. It's 10, guys.
It's not the 100th that we would be having popping confetti everywhere.
Not yet, we wouldn't. But
Yeah.
I'm going to tell y'all right now, this has been fun. This has been amazing. I know we say it over and time again, but I'm going to tell you right now, I just got off of a 3-day shift back-to-back in the ICU, and I am tired. But you know what? I have some crap to tell you guys, and this is going to be where I let it all out. All cards on the table.
This was about.
Holy crap, it was a crazy day. But before we get going there, I just want to, how's your week been? You been good? How's the jail?
Yeah, I'm surprised I'm still showing up every morning. Even my boss is like, "You're still showing up,
They're
still showing up."
They're sitting there like, oh, she came back today.
Yeah, I did have an inmate tell me when I passed his meds, he always looks at the officer and says, "How does she always have a smile on her face?" And I said, "Because I'm scared of you. I'm scared of you." No, I'm playing.
I'm trying to be nice. I'm trying to seem like I'm happy.
I'm scared. No, but I just, I like it. I like my job. So you do have a smile on your face when you like your job.
That's true. But dude, let me tell you this. So today was wild.
So you worked where today?
I was in the ICU.
Okay,
medical
okay.
ICU. We get there. It's my 3rd day in a row. We get there in the morning. Well, I'm hoping we get the same patients that we had the day prior.
Yeah.
But no, they give us a whole another brand new assignment, which is dumb because I'm like,
Yeah.
we already know our patients, right?
Yeah.
Well, whatever, no big deal. This lady's in there, so she's in there, right? She's there because she hit her toe.
In
and
the
she-
ICU?
No.
Oh,
at home,
okay.
And it broke her toe.
Okay.
But she never took care of it or cared for it, and she has diabetes and neuropathy. And so
Neuropathy.
neuropathy. You know what, guys? I'm tired. Shut up. All right. So anywho, but no, she hit her toe
Okay.
and she got osteomyelitis, became necrotic. She had to go get surgery.
And osteomyelitis, guys, it's an
It's a
infection.
bone infection.
It's
That's a bad one. Yeah.
bad.
So because I don't know if you know this, but the bone. Oh my lord, the bone itself has a crap ton of blood vessels because that's why a lot of red blood cells are made, and so it's full of blood vessels. So if infections in there, easily can go out to the rest of the system.
Exactly.
Right? So it's very dangerous. But yeah, so they cut it off.
Was she older or younger?
50s around there.
Okay,
I think
well, that's
so.
young.
Yeah. So they cut it off. She, uncontrolled diabetic. A1C is 14.9%.
Yeah.
So you know how it
okay.
is.
Yeah.
Just so you know, most of you know, but those who don't know, a controlled A1C, you're looking at what, like less than 6.5, less than 7.
Yeah.
Is what they want.
Yes.
Okay. So anywho, so she's there. She got this, whatever. No big deal. She's chill.
Yeah.
She's downgrade to telly. We're waiting for a room for her. That's all we are.
Yeah.
Because she's ready to post everything.
Yeah.
Her foot's elevated, wrapped up. Surgeon, surgeon after operation, the surgeon is the first one to unwrap it and do
Yeah,
the dressing
yeah.
change. So it's still the first dressing. So we're not touching it,
Yeah.
right? Just keep her comfortable. Give her some tramadol for some pain
Yeah.
and some gabapentin.
Yeah.
But that's about it. All right. So we left, and so we went to another patient. We're triple today. So we went to our 3rd patient, which was a COVID patient.
Okay.
So we're fully gowned, right?
Yeah.
I mean, we're gowned. We're in there. We're cleaning her up. All of a sudden, I hear, dum dum. I'm like, I'm fully gowned. And I'm like, I just heard a dump, like
Yeah.
something fell.
Yeah.
I think it is because I think it was the dude next to us because he had his tray on the side. I thought, and he's moving about, so I
Yeah.
thought he just knocked something over.
Yeah.
So I was like, hey, Stephanie, I'm gonna go check on him.
Yeah.
Okay, so I'm going to take myself up. All of a sudden, I see this nurse come. She goes, hey, do you have 10? We're like, yeah. She goes, they just fell on the floor. And I'm like, oh my gosh. I'm thinking in my head, I'm like, as I'm tearing my stuff off, I'm thinking,
Yeah.
how'd she fall on the floor? Because she can't move. She's bedridden, right? And so I'm like, no way. I said, Stephanie, it's our patient 10. They fell.
Yeah.
So, because I thought patient.
Yeah.
Dude, I get in there. It's the husband. It's a visitor. It's the visitor.
Oh.
So the wife, she's screaming like, "Oh my god,
Yeah.
help, help!" And we're like, "Dude, what's going on?"
Yeah.
And so I looked down. One of the other nurses was there. Had him on his side. He was convulsing. So we're like, dude's having a straight up seizure.
Yeah.
Right?
Yeah.
He's foaming at the mouth, and so She has him on his left lateral.
Yeah.
I get down. I help to just
Yeah.
he's not really flailing, but just making sure he doesn't
Yeah.
start going crazy. And the doctor gets there, and the charge nurse gets there, and she's like, "Hey, go give me the vital machine, give me a stretcher." And so so they're going. I'm with the patient. Dude's on the ground, just going. He finally slows. He gets out of the seizure, and he's got some like blood tinged speed. I don't know if he bit himself or we don't know what it was, right? And so I'm like, all right, like everything is happening. So this is at 9 a.m, bro. Like, I mean, we just got there. We just did med pass. I'm like, I'm still trying to drink a coffee, but so
taking that last bite of the croissant.
dude, I mean, like, it's like, really? And so he's there, and we're like, oh crap, right? So we get the wheelchair, and so the doctor's like, I picked him up and put him in the chair. She's screaming at him, like, what's going on? He's like, what happened? And the doctor's like, what happened? She said, he got up, he stood up, he walked to the sliding doors, because we have sliding doors.
Oh,
right?
yeah. Okay.
And she stood there for a second, just staring outside. And then all of a sudden he starts falling backwards, and he's the one that he fell.
Did he?
Dude, his
fall?
back of his head was so red.
So
I'm like,
he fell
smacked
straight
it.
back.
Yeah, and just hit the ground. And so
man.
we don't know if like he started convulsing first,
Yeah.
or because of him hitting the ground. Like we don't know.
Yeah.
So anyways, so we're right there. We get the wheelchair. We pick him up.
Yeah.
All of a sudden, he comes out of it, straight up fighting. This brother is throwing punches. He is pushing off. Get off me! Get off me! And we're like, dude, this is post seizure. Like, but this is
right?
another thing though, because I've seen a lot of post seizures where they're just so drained. You know what I'm saying? They're so
it takes it out.
So that's what we're like, dude. Like, is it because he hit his head and he got some like aggression? You know, because
like a head injury. Yeah,
exactly. And so we're like, is it that, or is it the post seizures going on? Like, we don't know what's going on. Right? So all I know is this dude's fighting us. We're trying to give him the wheelchair, and we're trying to talk about, hey, listen, like this is like, you just had a seizure. Like, we're gonna like calm down. Like, we're here to help you. And the wife is screaming. She's in bed. She can't move because her foot's all elevated.
Yeah.
And she's like, stop it.
She's telling her husband, or she's okay.
Here. And he's screaming, get off me, I'm gonna kill you, blah blah, going crazy. And so we're like, all right. So we get the vitals machine over here, and they do a quick blood sugar check. It wasn't blood sugar. He's fine.
Okay.
I know. And so all of a sudden, we're holding him in the chair, and the doctor's like, dude, go get a gait belt so we can tie him down. He's trying to get up. He's kicking everybody. All of a sudden, he goes, bah! He knocks one of the nurses in the face. I'm like, dude. And so, because I mean, we're holding him, but but we're not holding his arms, because he wasn't really going at everybody, but he was just like pushing, like, get off me. But as soon as he
hit her,
dude, like we grabbed her, and I grabbed his arms. I held him down.
Yeah.
Dude, everybody started coming over here, and I'm like, and they're like, dude, call security. Like, this is already it. So we can't give him nothing. I don't know if you knew that. Like, because everything is in the Pyxis, right?
Yeah.
We can't overwrite stuff, because we don't like. He's a visitor. He's not a patient.
Exactly.
That makes sure there's no med. So we're like, holy crap! Like, what do we do? So finally they call, and we call ED. And so apparently ED, you're supposed to call a medical alert. So you call code blues or whatever, right? Or a rapid response. Well, it's actually a medical alert. So that's for anybody that's not a patient, or a staff member. Okay. But when you call that, ED responds, and they bring like a little toolbox of all types of meds. Okay. So, and the ED doc, because they're the ones that are legally can take anybody and treat them.
Okay.
You know what I'm trying to say?
Like somebody off the street, like visitors, or
anybody.
Okay. Yeah, that's not there with the name, with the with the bracelet.
Yeah, because like we can't go pull any type of med. Cause we don't have, sometimes we don't have it up there.
Yeah.
But they have like the basic stuff, right? For seizures, for combative patients, like, Haldol, stuff like that, Ativan, right? Yeah. Anyways, dude, he's fine. We finally get him, and the security gets there. Dude, I see security walking. He's a big dude. He's just walking over there. We're like, dude, get your ass over here. Hurry up, man. And so we're like, all right, man, like, whatever. We got him. We finally give him out to ED. And I come back to my patient. We're trying to calm her down, because she's going wild.
I bet she's
she's scared. It's just so much emotion going on, right? And so we come back. We calm her down. She's like, oh, this is like the 4th time he's done this.
Well, that's good. She's giving you some history.
But this dude, when he's had it in the past, they've never called EMS. They never took him to a doctor. He is undiagnosed, untreated.
So they would just let him kind of wait.
She just lets him do whatever.
And just come out of it at home.
Yeah. And so, sad. But like, and so what was weird is She said that he smokes marijuana, but he also does synthetic marijuana.
Oh, and you hear a lot of bad things about that.
We found his vape
With
in his clothing up when we were
Yeah.
packing his stuff up, and so we were thinking maybe it was the synthetic
Yeah.
something in there that he was doing it that just caused him. We don't know because
Yeah.
it wasn't matching up. Like post seizure, you don't only see this much of agitation.
yeah.
But I mean, a lot of time it's just they're just so drained from it. You know what I mean? They're just
Yeah,
so tired.
exactly.
They're lost.
Yeah. Yeah,
But
yeah.
I mean, at the same time, one of the doctors was like, "Well, I mean, like he came out of it, and she's everybody on him. We're trying to calm him down."
Yeah.
But it gets to a point to where, yeah, I understand when you calm down, but when he's actually physically moving, trying to
Yeah.
run away, get away, it's more like, you know what? No, we need to secure him because he's gonna hurt himself or somebody else, right?
Yeah, of course.
But yeah, so anyways, he went out to ED. Day goes on, maybe like an hour go by. Our charge nurse comes back. She goes, "Hey, just found out that he left AMA.
He just
He
took
just
off.
yeah, he just left." And so, and we transferred her because she had finally because she was on telly, right?
Yeah.
She's waiting for a room. She finally had a room, so we took her to a room, and we're like, sorry, one of your husbands that he left AMA, and she has all his phones and everything. So we're like, I don't know. We don't know.
And he probably isn't gonna come back and
Oh no,
think he's gonna get in trouble.
dude, we don't know. Like that was so weird situation.
Yeah.
Like we did
And how-
we did an incident report. The house soup came.
Yeah.
We did all the stuff, and
And how was the nurse that got hit in the face?
she was like, "It's all right, man. I got kicked in the groin last time. Not a big deal." She was like, just spitting blood. I'm good.
She's just spend the tooth out. I just stick it back. I'll put it in milk. That's what they say. That's crazy. But I have heard from people who are marijuana experts that they do say if you're going to smoke marijuana, not that I condone it at all, but they say that synthetic. I mean, if you're going to smoke marijuana, smoke the natural stuff because
Yeah.
they said that synthetic. You don't know, it can mess you
No,
up.
it's just that's what one of that charger was saying. She was like, "Is this? We've been seeing a lot of the synthetic stuff. They're laced with
Yeah.
something, and
Yeah.
they just do something horrible to people."
Yeah.
But yeah, so that was that. That was just the morning. We're just sitting there. I'm like, and you know how like your adrenaline's pumping, right?
Yeah.
Dude, we're done. I'm taking my long sleeve off. I'm just sweating.
Yeah.
My nurse is sweating. We're just sitting there. We're like, and then all of a sudden we hear, ding, ding, the call light for their other room. We're like.
They're like,
Yes.
they're like,
Can we help you?
You forgot about me. I've been timing y'all. Yeah.
Oh man, no, it was wild. But so that was my morning. But after the evening, it was all right. I mean,
Yeah.
it chilled out, nothing too
Just had
crazy.
some.
It was that
excitement.
morning, just right in the morning, just a smack in the face. Because me and my wife was talking. We're like, yo, our first day, Thursday, was a chill day. Like I
Yeah.
mean,
Yeah.
super chill. And if you got 3 days back to back, one day's gonna be crap, right?
Yeah.
Tuesday, it was all right. We had some crazy incidents. We had one patient almost died when we turned him. Like we literally rode him to clean him, and his pressures dropped below 20. And we're like, and so we gave him epi.
We're like, we're so
no,
sorry. We're gonna put you right back where you go.
no, we were literally gonna like. Well, he was a limited assist.
Yeah.
Limited.
For his ADLs,
What's it called? Not a limited assist.
limited assist.
Oh my gosh, I'm blanking out. Like whenever you
Um,
when you like, he's not DNR, but he's not full code. He's a limited arrest.
okay.
Limited arrest. Only chemicals.
Oh,
he
okay.
didn't want no
Get it.
compressions or
Yeah.
shocking, whatever, right? But yeah, so we turned his brother. I mean, he's on every presser. I mean, he is really in bad.
Yeah.
He's in really bad shape.
Yeah.
And he's getting it's called Prisma. It's like
Yeah.
bedside dialysis, but it's long term. Like it's over a 24-hour period. It's
okay.
You slowly diffuse them, right?
So it's not
whenever
like-
they're
it's not
really
the-
sick, you don't want to cause huge, massive shift changes in the
Yeah.
body. You do that versus dialysis. Because dialysis is what 2-3 hours.
Yeah. Yeah.
And you're done.
Yeah.
But they pull so much. But most people who are healthy, they can deal with that.
But with him, his pressures would drop.
whenever someone, usually in the ICU, when
Yeah.
they're really sick, you're gonna do this 24-hour
Yeah.
dialysis, right? Anyways, yeah, this brother's just sitting there, he's known the man, like every person on the man, and all of a sudden we're like, hey, one nurse like, hey man, can you and your nurse blah blah blah
Yeah.
come help me? Well, all right,
Yeah.
she goes, we're gonna log roll him,
Yeah.
we'll clean the backside, put him back down,
No problem.
easy peasy. Here's the art line, right? Remember,
Yeah.
MAP 65 or better. We
Yeah.
want that because that means that's perfusion to the brain.
Yeah.
He's 70 right now. We're golden.
Yeah.
We turn him. We wrap up. I look up. I'm like, oh, because I don't even notice, but the art line, it has like a little piece on the end, and you have to keep it level with the heart. So whenever they're laying, you need to move it. And so if
Yeah.
it's even, you can have an accurate reading. If it's too high, you can have a false low reading,
Yeah.
or vice versa, right?
Yeah.
So it dropped down to 38 map, and I'm like, oh, did it fall? And I'm looking, and it's right there. I'm like, that's not good. I'm like, hey, do you see this? And she goes, oh my God, put it back. And so she'll turn up the presser. And so we turn up his his presser, right? It was Levofed, and no, excuse me, Levofed was maxed out. We were using his vasopressin. We started titrating the thing up, and it just stuck there at the 39, 40. And we're like, oh my God. She goes, no. And she looked at me, and she goes, Noah, call for help now. And so I ran outside. I was like, I looked around. I'm like this. I'm like, who do I know? I'm like, and so I called someone. I said, we need help now. And she came over, and the doctor, he was right next door here. And she goes, doctor. And so he comes over here, and she's like, we can't get his pressures up now. And like, she goes, all right. He goes, you have epi? Yeah, we got epi. Draw up epi.
Yeah.
Push epi. They're like this is a code right now. We're coding him pretty much, right? Like we're coding this guy, but I mean, like, we don't no compressions. There's no card because we don't want that. He just wants epi. That's all he wants.
That's kind of weird, right?
Well, some people, I don't know. Some people don't want to have. It's just weird. I think it's weird. If you don't want to do the whole thing, right?
Yeah.
But anyways, so we pull the epi up, and she pushes it real quick, and we're watching it, dude. That thing, it was like 55 over 30 or something stupid low, right? It jumped up to 220 over 100. We're like, oh my God. Like, we're like, mom, we're like, oh my God, we're gonna stroke him out. We're gonna stroke this dude out.
Or y'all were like, we're gonna go ahead and write the order DC to JC today.
Dude, no, we were like, oh my God, right?
Yeah.
And so we're like, turn off the pressers. So we turn off all the pressers, and the doctors, and we're like, you can give stuff to bring it down.
Yeah.
But he's already so low, and he's on everything.
You don't want to mess with
We're
it.
gonna drop him again.
Yeah.
It's teeter-tottering, right?
Yeah.
The doctor's like, hey, we're gonna wait this out because epi actually metabolizes really fast.
Okay.
So it's maybe like it took maybe like 20 seconds, and then finally it metabolized, and it finally started coming down. And dude, that was the longest 20 seconds. We're like this. We're like 1 Mississippi, 2 Mississippi.
Could you hear the clock? Doop. You know how the second hand goes doop.
Dude, it was wild. But he came back down. He was
like,
fine.
Hey guys, what's going on?
Oh no, he was intubated. He's intubated. He's on sedation. Like, this dude is. He's really not
sick.
good. Like, he's really sick. But I mean, we're like, oh my God, like, Lord Jesus, not today, please, not today.
You're like, girl, we can't help you no more. You have to find somebody else.
But today, another nurse had him, and she's like, hey, can you help me?
We're like, no.
Nope. I'm like, no, I don't want to be a part of that.
I'm fixing to go help my COVID patient, and no, get somebody else to help you with that.
Dude, it was a crazy day.
And if I was you, just drop some epi just in case. You never know.
Oh my gosh, they literally kept the vial of epi. You know what's crazy? Their crash cart. They don't have like the pre-filled syringes of epi. I don't know if you see. I'm talking about. Have you seen a box of them that like it's one syringe and you already fix it?
Yeah.
And it's already diluted, 1 milligram and 10 cc, right? Well, they don't have that there. They have literally just the vial of 30 milligrams and 30 mLs, and so you literally have to draw up you have to make your own epis.
Yeah.
Oh, that's the tip of the day I was gonna say. I'll get back to that. But anyways. Remind me of epi. Just remind me of epi.
Okay.
But anyways, yeah. So I was like, oh, that's crazy. But no, dude, like, it was wild. And then we had another patient that a dude got released from jail. And
Was it from my jail?
No, it wasn't your jail. And then he OD'd, and they brought him in, and
That's sad.
he's anoxic all in his pretty much in his brain. But
Yeah.
he's a young guy too, man. I mean, we had him a couple days ago, and it sucks because, like, you're looking at him and you don't, without looking at the history, you just see him and, like, he's just a normal guy.
Yeah.
But, he had made bad choices.
Yeah. And like speaking from the jail point, they're there for so long, and they, of course, you don't do drugs there, and they look good. And I know this one guy always says, when I came in, like, I was this skinny, blah, 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 and, they look good. But then it's crazy when some of them, when they leave, they go back and they do
it's
that.
The same thing.
They go hit drugs real quick, and
But I mean, it sucked. I mean, he's still there. We finally found the family, and we got them involved, and they still want to they think some of his reflexes
Yeah.
of him moving and yawning and gagging when we suction is
Like a
him
good
there,
thing. Yeah.
but there's
Yeah.
nothing there. Like he
Yeah.
fails all his because he fails pretty much everything. He doesn't follow no commands. He has no pupil reflexes. Everything's blown.
Yeah.
I mean, there's just nothing there.
Yeah.
But you know, we can't do nothing. And they say no, we want everything done. So
Yeah.
all right, so we'll
Yeah.
see what happens because like the next step is either we trach him, give him a G tube,
Yeah.
and then send him to a LTAC.
Yeah.
Or you know,
Yeah.
make him hospice, make him comfortable,
Yeah.
and let him pass peacefully.
Yeah, I guess the
But
family has
but
to kind of get over that.
oh yeah, but I mean they're not in that moment right
Yeah.
now. So they're like, all right, I mean you take as much as you need, but we're gonna have to talk pretty soon.
Yeah.
But no, I think I would like to be comfort care because I don't think I don't want to be kept alive by tubes or nothing.
Yeah, because
And this is for a live recording. Y'all will see this. You make sure nobody keeps me alive by tubes. I
Yep.
don't want nothing. I'll just let me go. I want to go.
I'm just gonna keep this video on my phone so if anything happens. We're
But
like,
seriously, I mean, like,
No,
we've
talked
yeah,
about it
but
before.
seeing people like
Yeah.
living like this,
yes,
I don't think that's living. Because I heard a doctor say when he was talking to them,
Mm-hmm.
he made a very good point. He goes, because one of them asked, "Well, he's alive, isn't he?"
Yeah.
He goes, "Yes, but is he really living at this point?"
Yeah.
And I mean, I think that's true. I mean,
Yeah.
I don't. To me, that's not life. Not
Yeah.
being able to. I mean, there's nothing there. There's nothing there.
I remember this is years ago. There was this young guy. He lived out of town from Seguin, like a 20-minute out of town in the country.
Uh-huh.
And I remember he was an only child. He was the only son. He worked a security job, going home early in the morning, and fell asleep. And he was like that. And he was basically, the mom would see him kind of move or whatever. But I remember he had a G tube. I always wonder what happened because he moved out closer to where she lived. But it's like you said, like she would always say, no, like he's fine. Sometimes, and he was, because, having a G tube, you can basically live forever.
No, exactly. I mean, literally,
know?
all you're doing at
Yeah.
that point is just, you're just
just-
giving
you
your
need nutrition.
tissue. You're giving your tissue just the right amount of nutrition
Yeah,
to stay alive.
Yeah.
But really, I don't know. To me, that's not really living.
Yeah.
But I just hope. I just hope they can come to terms with this
Yeah.
because, I mean, I don't know if he's suffering. I don't know what's going on.
Yeah.
But I don't like it. I really would advocate for this patient that
Yeah.
at this point it's better for him not to be
Yeah.
suffering like this because
Yeah.
he has a tube down his throat.
Yeah.
He's constantly pooping on himself
Yeah.
and he's getting bed sores already because all that acidity
Yeah.
is already just eating his skin.
And he's probably got some kind of pain, but not can't voice it.
I know, and I mean, and we're constantly on a schedule with pain medication
Yeah.
to keep him comfortable.
Yeah.
But it was crazy. See, this is what got us though, because he's
Mm-hmm.
intubated, right? But he has no sedation. This is the biggest thing. This is
Yeah.
why we tell him, like, listen, like, he doesn't follow commands. He's been off of sedation
Yeah.
for 2 days. Anybody
Mm-hmm.
whoever had intubation and they come out of it, you want to yank that tube out
Yeah.
because it's super uncomfortable, man. And,
Yeah.
and so
So he is not. So basically,
there's nothing. Like I said, he's
Yeah.
not fighting. He's not moving. He's not following commands.
Yeah.
There's nothing that he has no sedation. He has no drips running.
Yeah.
So we're like, there's
Yeah.
nothing there. There
Yeah.
really isn't. It's just the body at that
Yeah.
point.
Maybe just over time when, I'm sure they have the doctor or maybe someone
yeah.
over time it'll sink in. Because
I hope.
Yeah.
But I don't know. Like I said, I go back Thursday. Next Thursday is my last day,
Uh-huh.
and I'm done with that place.
I was thinking about you today. I was with my grandma today, and I was telling her, I thought this was Noah's last day, and I was like, oh my God, we were supposed to make your, get your precept or something. So
I
we
don't.
gotta
I
do
don't.
something.
I don't know if she'll see this, but I already did get her something.
Oh, okay.
So
I was
next
thinking about
Thursday,
that.
I'll give it to her.
Okay. And
Stephanie, if you're watching this, girl, I'm gonna say right now. All right, listen, I gotta say it. This might be a little bit longer episode. We're at 24 minutes, but anyways, I don't care. So listen. So she got her stethoscope. A grew legs and walked. Right.
okay.
A grew legs and walked. And so I'm like, hey, like, because I got her a nice stethoscope case
Yeah,
and a little the charm with your name. That you
Oh,
put,
yeah, yeah,
I got her one of those,
uh-huh.
right? Because she has a little pencil bag that she puts a stethoscope in. I'm looking at her like, Stephanie, you're a nurse. Buy yourself a case.
Yeah.
She goes, no, I'm okay. She's very humble, right?
Yeah.
And so I'm like, you know what? I'm gonna buy her a case.
Yeah,
A nice hard case, right?
Yeah, to keep it in.
And so Wednesday, she's like, hey, Noah. I'm like, what's up? She goes, can I borrow your stethoscope? I'm like, yeah, what's up? She goes, mine's missing. I'm like, what do you mean it's missing? She
You're
goes,
like, great. I just
no,
got
I was
you.
like, and so the whole day, I'm like, so are you gonna buy another one or something? I'm trying not to be like inconspicuous,
because
right?
I'm leaving. You can't borrow mine anymore.
No, because I got you a freaking stethoscope kit. It's awkward. You don't have one.
She's gonna be like, "Ow!" She's gonna be
I
excited.
know with
thinking
the
it's just-
charm, too.
She's gonna be like, "Oh, Noah got me a stethoscope." And
Oh,
it's the
dude,
case.
yeah. And so the whole
Oh.
day I was like on Amazon, I'm like, you like this one? And but she finally bought one. And so, I mean, if you watch, of course, your phone will go off right now. You
It's
know
my
the
mama.
rules.
Mama, if you're listening,
Yeah, but no, it was. Like I said, it's been a crazy
Oh
couple
my
days.
God.
Have you
Let's
seen
see.
Have you seen any good movies?
yes, let's do my
Oh,
let's
you
do
wanna
a
do-
good voice.
All right, go ahead.
So today I saw the new John Wick movie, and as a healthcare provider, there's a part where he falls 270 something steps outside, and he's rolling and rolling and rolling down the river. I was literally timing it, and he gets up and he goes back. And I said, I'm done. I got up. This is unbelievable.
Oh my god! But no, seriously though, you look at that. You're like, bro, like you have broken neck. You're gonna have broken. I mean, like, there's no way you
Wrist.
survive that. Yeah.
A broken wrist. I just was laughing, and because when you're in the health profession, you think of things like that. And I said, no way, this guy is living and getting up to go fight more people.
Oh my
So,
God.
anyways, I thought that was funny. And then my husband's like, no, it's like, I think it's like, yeah, it's possible.
Oh my
no,
God.
it's not. Your neck will be broke.
Bro, people fall down like 5 flights of stairs and die. Like,
Yeah, I told one time I fell off 2 steps, and we've all done it. Think about your stories. I had a sprained ankle, swollen, bruised, and I thought I cracked a rib. Come on, that was like
200
2
and something steps.
Can you imagine? And it was so long. There was people even in the theater. You can hear mumbling to their whoever. They're like, that's all right. And you're just like. Doom, 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 doom. And I'm like, dude, this is not
oh
not
my
right.
goodness,
But
dude.
anyways.
Hey, movie magic, right? Movie magic. Hey, but you know what's crazy though? Like you say, like your nursing comes out. You're like, oh, there's no, like, your medical side come out,
Yeah.
like, oh, he would have had a concussion, broken neck, maybe. But I'm just
Yeah.
saying, like, you wouldn't survive that. You ever get like a weird pain somewhere, like in your chest or your arm? You're like, am I having a heart attack right now? You're like, huh? Oh, you have a weird pain in your back, like,
Well,
I have scoliosis.
as a woman, because I've heard other women say this, sometimes we get like a boob pain.
Oh.
And right away, and the other day I went, ow. And then right away someone said, have you had that checked out? That could be like cancer. And I'm like, honey, I've been getting mammograms since I was in my early 30s. So I have one every year because I have to because of my body, of my genetics. But yeah.
Goodness, dude. That's crazy. Shoot, dude, did you hear what's going on in Austin right now?
Yes, guys.
Have you heard about Austin? If you haven't heard about Austin, we're going to tell you right now, but Google Austin.
Austin, Texas, if there's any
What's the title? Go. What is it? Austin what?
Texas?
No. What's the title of the article?
There might be.
Killer. Wait,
Oh,
ready?
okay, my bad.
Okay,
Hold on,
hold on. Breaking news. There might be a serial killer in Austin, Texas that they might be trying to cover up.
What? Sorry,
By
guys. I'm
the
still getting
lake.
used to this.
Yeah, but that's true. And I found out today, because my husband, we were talking, and he goes, "Hey, did you hear that Austin? Because this man, he was missing. Went to a bachelorette party, turned up missing. He was dead, and they don't really say much, but he was found in the lake. This isn't the very first one, and then
Is it like multiple murders
Yes,
or
and
dead
they're-
bodies they
and
found
they're-
around the lake?
and they're kind of been spanned,
Yeah.
So that they always say about serial killers, like they kind of go
They
back
have
the
like
same
a
place.
signature. They have a
Yes.
signature they want to leave behind.
And so people
I'm sorry, but I heard.
What?
I was watching a documentary one time about I think it was John Wayne Gacy or somebody.
Yeah.
But it was a serial killer. But like a lot of serial killers, like they leave clues behind because they
Yeah.
actually want to get caught. They actually want them to know that this is their.
Well, like Silence of the Lambs.
Yeah.
Remember that one when with
Yeah.
Clarice? That guy would always put those certain moths like in their mouth. Yeah.
It's like
And
the
it's
calling
ca-
card.
yeah,
Like the calling
yes.
card. That or like the Joker leaving the little, doing the Joker card.
Yeah, yeah.
Leaving the Joker card. Or the Riddler leaving that big old
Yes.
question mark.
So they're kind of saying like,
Those of you who don't know, those are superheroes.
yeah, and so they're kind of saying like it's just like they didn't want to say much, but like people are like, they need more security, they need more like lights and stuff. But I'm just gonna say this. I don't want to offend nobody, but Austin, they don't like the police. So I don't know. You're kind of on your own over there. You
Dude.
know, they don't.
Yeah, but
They
it's
wanna-
funny. This brings up because my dad is running this 10K tomorrow in Austin.
Yeah,
and
the
so-
Capitol 10K.
And just saying the serial killer is looking, main victim is men, like middle-aged men, and we're like, hey, like Dad, I love you, brother. Be safe. Just run faster. We hope that if he's there, the
would've-
serial killer is like starting off. Coming after you, so you still have energy to run. Not like when you're like towards the end of the 10K,
Maybe-
so we're all tired. You're like, you know what? Just take me.
Stay with the group. Stay with the group. And he's washing clothes right now, and he can probably hear us because we can hear ourselves.
I hope he can hear us.
But maybe that encourage you to run a little faster time and run in your truck. Don't talk
Dude,
to any strangers.
What if the guy is a runner too? What if he's running this just so he can scope out the competition? If you know what I mean.
What if he tells my husband, "Hey, Ed, come here. I want to show you. I know a shortcut."
I don't know. I was like, is it? Don't just knock him out.
I'll be like,
Like damn. I know Dad's slow, but not that slow.
I'm
Did
not-
he get injured on the way over here?
"Hey, he was supposed to come make hamburgers for my birthday. He's missing."
Oh yeah, tomorrow's your birthday. Happy early birthday.
I'm gonna be 48.
48.
48.
Hey, at least not 50 yet, so that's
Yeah,
so good.
I know.
But wait till you're 50. Well, we're gonna be all 5 and get you a little stretch or whatever. Oh my goodness.
I'm gonna get a little. Then I can start getting a placard.
A
in my
plaque.
car.
Oh man, well this has been fun. Like I said,
Yes.
I know it's a little long, but you know what, guys, I
Got a
don't
lot
care.
to say.
Yeah, dude, like it's been a crazy the past, and I can go into more detail and more stories.
Yeah.
But I think those were the highlights. Those were the things I was just looking at them. I was like no, those are the moments you're like this. You're like, do I need this job? Do I still want to be a nurse?
You're like, things that there's an old song that says things that make you go, Now I know why.
Dude,
Yes.
oh, I gotta show you this TikTok later. My buddy sent it. It was like, dude has explosive diarrhea, but it was like shooting across the room. It was all over the floor, and like they were just recording, and they were just like, and they turned their face, and they're like, "I'm done. I'm done with life." I'm like, "Oh my god." I feel bad for the dude though. I don't know who it was. It was a TikTok video. So, but anyways, I got something I want to leave with y'all. Like I said, we'd like to give y'all some tips or
Little-
and motivation for the day.
Yeah,
'Cause,
positive
you know,
stuff.
life does suck, but if, you know, keep fighting, keep pushing,
Yeah.
because you know what, you can make somebody's day easily.
Yep. Mm-hmm.
I know I did today, and that's a story for next time. But my tip of the day, my tip. If you know this, you can get 100 ml because you can get epi in the 10 milligrams and 10 mLs, right? You could get a 100 ml bag and inject the entire 10 milligrams of epi into that bag, and now you have 10 epi flushes, not 10 epi flushes. Oh, it's 100. Yeah, no, you have 10 epi flushes straight from that one bag. So I was talking to one of the nurses there. She goes, yeah, when we usually run codes,
Yeah.
the pharmacist makes a 100 ml bag of 10 milligrams of epi, because now, cause I don't even know this, but concentration of epi should be 1 milligram per 9 mLs of normal saline. So it's a 10 ml syringe, right? Well, if you have a 100 ml bag, it's right, everything's pre-mixed. You pull out 10 mLs, that's one epi. So you have 10 epis right there.
Oh,
And so that's what they do. They
cool.
have
Yeah.
the bag there, and he's just constantly pulling from that one saline bag. But I mean, that's pretty cool.
Yeah.
I mean, like that's something y'all can think about. I know sometimes the ambulance they make their own epi bags as they're coding somebody
Yeah.
with ER or whatever. But anywho, the only time you fail is when you fall down and stay down. Don't ask me who it came from. I just stole it from the internet. I don't know.
I got a good one. This
Okay,
is the
what's up?
truth. I've always liked this one. From Mark Twain. If you tell the truth, you don't have to remember anything. And that's so true. Always tell the truth. Because then you don't ever have to be like,
So that
what
means
was
so
that?
that means when you're working as a nurse and you opening the patient's pills and you drop the pill on the floor and you're looking around, you're like,
One.
and
a
they're
dozen,
asking,
two.
hey, did you drop my pill? You're like, I want you to remember that, Mark Twain. I want you to
You're
remember
like,
that.
And they're like, what's that by your foot? What?
Oh man, well that's all I got for now, guys. We'll see y'all next
Thanks,
time.
guys.
Have a great
Have a
one.
Great
Peace.
week.